Further up, you're doing neutral. And when you're going further down in the cervical spine, you're doing the 30 degree. 30 degree.
So we're thinking that's 30? Or
It looks more than 30 to me, but you would have to look at the actual manual.
Do you need a towel?
that's what I was thinking. If you didn't have a manual, you could do it with the...
Yeah, where's the goniometer?
Okay, so I'm supposed to, is it hook under here, right?
Yes, it does. And in the clinic for ours, in the clinic that we use over and over again, we put a towel because ours is uncomfortable. This one is nice and padded. Some of them, these little parts that grab you on your occiput are kind of narrow and hard and uncomfortable, so we use a towel. But this is nice and comfortable. It is moving.
It is. Maybe it's just the angle that I'm at. I can't see.
Okay. Put your
I just know that I have a big one. A big head.
Okay. Alright, so you feel like, you can tell the patient that you want it to grab here so that they kind of have a guideline of where they're going to lay down. So they lay down and she feels it there. This one is hard to feel when it tightens, like the one we have in our clinic. When you tighten it, you can kind of tell. This one you don't get as much resistance, so you'll have to rely on the patient to tell me when that starts to feel snug. Okay, so see, I didn't feel any resistance hardly. So for here, we would use a towel or a pillowcase to put across our forehead. I usually use a pillowcase. Dr. Marston was using a towel. And thick. So I use it. But it doesn't matter. Her legs would not be positioned like that. They would be on the stool or on some pillows or on a ledge. And this strap is to cue. This strap doesn't do anything other than cue the patient to keep their head in the unit.
Is that comfortable? You were closer to your butter.
Oh yeah, that looks very.
Does it feel comfortable?
Is that
You want pillows instead?
You want to
Put a pillow on top of it. Put a pillow on top of it.
I was real comfortable Indian style, guys.
George, did you measure the
I
angle?
think she would probably.
I mean, where would you...
Just
So you're actually trying to look at what the cervical
Pull it
flexion
down just a
is.
little tiny bit. The
Down this
stool.
way?
Just a tiny bit.
There.
Yeah, just take my size. My hands. Okay.
it's through the ear.
Oh no. I mean, just look at what angle her head is against the table. Just get an estimate.
Just go parallel to the table.
So yeah, just go parallel to the table. So we're approximately 30. So we'll ask Dr. Martin at that 30.
So do you think that the small one's 15 and the higher one's 45 then?
Yeah, probably. We'll
I
ask.
passed my goniometer count already.
Stationary arm,
Okay.
parallel to the table.
So this,
Movable arm.
this just cues her
In line with
Some
the
patients
slope.
will not let you put this on. If the patient really doesn't want me to put it on, I will put it on real loose like that and ask them if that's okay.
one
Because
this
that
way.
will still cue them if they start to lift their head. If they lift their head out of the unit's going to pull up and they're done, okay? So, oh my goodness.
I don't care about my hair.
Okay. So, well, I was trying to do it loose, but I'll just leave it on. All right. So, the question for your comp for using the home one is: are you using it as if it's your clinic one? And if you are, then you're going to pump it up and set a timer for your 60 seconds if you're doing 60-20, right? And then you'll have to release it for the 20, right? And make sure. I'm not sure how they're I didn't even think to ask you that before. For the comp, for them doing this, are they teaching the patient to do it, or are they doing it and staying with the patient?
We would probably teach them to teach the patient, because that would be probably most realistic for this unit.
Okay.
For this unit, unless we're just wanting to do it for 5 minutes, we easily could set it and come over every minute and change it. We haven't wrote those comps,
Okay.
but I am probably guessing that we'll probably teach you to teach the patient. That is more realistic.
Okay.
That's more realistic.
Okay. All right. So it has hold and it has pump and it has release, and it's on release right now. Okay. So to turn it up, we're going to do pump, and we're going to do it pretty low for cervical for the first time, right? So we're going to go to 10 and see how she feels. And you have to practice with this because it does go up kind of slow. I mean, kind of fast. So how does that feel? We haven't determined.
Okay.
So
What did you
I was just asking, I mean, what type of distraction would we be working on, like a C1 bulge or?
a C1 would you would put it more neutral.
Okay. So with the flex position, we'd be working more on like nerve impingement, maybe?
No, it could be a disc bulge, but it would be more. It would be lower. It would be more middle. Yeah, middle. You could bring it up even more if you wanted to get even further down. How does that feel?
So the more
I can't
angle,
feel anything at all.
the
You don't
more
feel
angle,
anything at all.
the lower you're working.
Okay. So do you feel like it slipped, or do you
The
feel
more
like
angle, the
there-
lower you're working on the cervical spine.
Okay. So now she's on
The
12, and she's saying
Flatter,
more
more neutral.
So
the higher
we'll
up.
do, just for purposes of, this is your second treatment. We're going to do 15. So we're on 15 there. Is that okay? Okay, and we're going to put it on hold. So
Did you
now,
lose any air when you switched it?
I did not.
Okay.
So then she would hold it for 60 seconds. Yeah. And let it go off.
So she, like the patient, would have like a stopwatch or something on to do
They
it
would have to have a
themselves.
timer. Unless they were doing the shorter, then they could count. Yeah. Or they'd have to have somebody to help.
Yeah, I have it.
It's usually a timer.
Mine's right
Usually
there.
use a kitchen timer.
I'll get it for you.
Okay, so it's been 60 seconds, so now you put it on release and let it relax.
I think that is the part that I hate is when it goes down. I don't like that.
It's 10 minutes with the cervical.
And you-
If she had a disc, 10 minutes is the same as the lumbar. If she had stenosis of it, you could do it for 20 minutes. You could tell her. Now, the challenging thing is
That's
with stenosis,
16.
is on for 15, on for 15. This type of machine doing it that way is not cheap.
So for what we would be doing, 60 to 20, it would be like 10% of the body weight.
And see
Is
if
that
it
right?
works. And
Or
see
like
if it
11 to
works.
15 pounds, like you said?
Yeah, she just said for your first treatment to
Okay.
do 10 pounds.
And then to elongate the tissue would be the 60-20. And then the other ones is 1-to-1.
And like she's saying, it's not really realistic to do 15-15 with this for a patient at
Yeah.
home. So.